Effettivamente paziente sono...
That's what.
You talk about EA7, the day you talk about Azora, you talk about last, or what happened last season. Last season. But I guess also, no problem.
Yeah, no worries.
We're Bardic.
Yeah, no worries. No worries. I'll let you know when he goes, yeah?
Yes.
Thank you.
Okay, yes, sir. Thank you very much.
Okay.
Is to build a state-of-the-art facility with the ground floor pretty much dedicated to NHS dentistry. So that's the vision. So there would be 8 to 10 rooms there, and that could have sections in it which is kind of a deck for children, for example.
So this is where we're trying to basically identify the patients with high risk of dental procedures. For example, if something is we target certain patient cohorts. So unfortunately, as there's 33,000 patients registered to the medical service, we only have appointments available for about 2,000 people. So there's always going to be some patients that we're not going to be able to be seen by the service. So how do we prioritize these patients? I'll go into this later with the graphs, but this is how we organize the appointments. So, as dentists know, but sometimes doctors and other professionals don't know, there's always links between systemic conditions and dental conditions. For example, diabetes. So someone who has poorly controlled diabetes, they're more likely to get gum disease. But what they don't also realize is someone who's got bad gum disease is also more likely to increase their level of diabetes also. So this is something we're trying to manage and actively prevent and promote from the stabilization of their diabetes and also their gum disease. Nowadays, as people are living longer, they start to take more and more complex medications. So this is where we're trying to identify the patients who are high risk for dental procedures. For example, if someone's taking bisphosphonates, which sort of helps with the bone turnover, what we're trying to do is if they're having some extractions, we can sort of pre-plan the appointments so they can basically have the procedure done more safely. As people are getting older, they start to take stuff like blood thinners, steroids, and a lot of people on other medications, which in combination can cause death. Another cohort of patients that we're trying to focus in this practice is pregnant and also children that are vulnerable. So what we're trying to do is, what people don't realize is in pregnancy, the hormonal changes can cause a lot of issues in the mouth, especially with bleeding gums. So we're trying to tackle that. What they find in a lot of studies is people who have a lot of dental issues can sometimes lead to preterm birth. So what we're trying to do is we're trying to mix the medical and the dental side together to try and avoid any problems. So what we're trying to do is we're trying to do a patient-centered approach. So we don't want to work in the traditional service model, which is the current UDA system. We're trying to put the patient at the center of the treatment. So this is how we identify patients. Because Thistlemoor has been around for about 30 years, it's a practice that we do with trust. So we don't have to build that relationship with the patient. We've only got 2,000 appointments available due to the current funding. So we want to target those high needs groups such as diabetes, pregnant, the frequent attenders, the patients that always go to the doctor for a prescription because they've got an abscess. We don't want to be wasting the doctor's time, so we want those patients to have treatment already, so they don't have to occupy other services on the NHS. And then obviously we've got the high risk medications and the vulnerable children that I mentioned before. So these are some of the initial findings. So what we found is obviously with the patients that are booked in, most of them didn't have dentists already, so we were actually making quite a big difference to the service. Hopefully this can allow us to give preventative advice and onward care before the problems get through the medical software, and it allows us to identify these patients before, so we can do some prevention, and if they do need extractions, we can plan it appropriately for the patient. But based on the feedback, there might be some things we never thought of, so what we're trying to do is address the problem before it becomes worse and then we can't go back. These are just some early feedback comments that we thought we'd added on. As you can tell, everyone seems to be pretty happy with the service. We've got quite good Google reviews at the moment, so hopefully we can carry on with that. And so what the next outcome steps are, so hopefully we've just started the service, so we're just working out our way through the list of patients, and we just want to...
Today, Dr. Rameez function here in Thistlemoor. We're giving out food, and it's time to eat for us. Is it a video or is it a picture?
There's no picture, it's video.
Just a video.
Yeah.
It's all about him.
M.
Ganhar não esquece de grandes estados.
Video.
Moment.
J.
My man Jay.
UK?
This is my man Jay. And this is my main man here, my brother.
Thank you, boys. I tell you for doing your stuff.
Yes.
पहला वीडियो बनाने हैं चाचा मैं
आज दसो जी आज क्या फंक्शन है कौन
ये आइए जो सबसे बड़ा अफसर है ना
जी
चीफ डेंटल ऑफिसर पूरे यूके ना ये कम टू विजिट पता है संजला ओपनिंग की थी सी उसने फिर इस तक क्या अच्छी तरह 3-4 महीने ये तक क्या क्या वीडियो है
अपडेट was there.
अपडेट
Sorry.
So आज ना क्या है अंकल जी उन फंक्शन जिला खाई रसम साहब जो जैसी इस तो बाद जो अंदर
फिर
फंक्शन
तुम्हें पैसे दे सा तो हमने देते
okay
अच्छा और देखा कि डिनर अच्छी ना और टीवी वाला बनाया ना कुछ तो थोड़ा कर भाई के
مشاكل بيان नहीं है मुझे कुछ समझता नहीं
No, they didn't.
तो दिन में आते हैं
वो क्या भी
ओके
साढ़े 12 बजे रात